Hello friends, welcome to Srinetralaya. In this video, we will see a case of grade 2 to 3 cataract, and we have managed it slightly differently. So the main incision and a side port of 23 gauge is made and visco is injected into the anterior chamber to form it. Once this is done, I usually use a 5.5 mm rhexis marker to have a perfect rhexis. This guides us to have a good rhexis. That way we will control our rhexis and the movements are better. So rhexis started with cystitome in an anti-clockwise direction with multiple small steps. It is completed in a curvilinear and circular fashion. You can note it is very easy to perform rhexis and you should not press the nucleus while performing it. Once it is done, a hydrodissection is performed with a 27 gauge curved cannula. Anterior chamber again is formed with viscoelastic. Centration of the eyeball is achieved. Now we will proceed with the phacoemulsification. To start phaco, I am using here a side cut chopper from Epsilon. I usually rotate this nucleus so that it gets free from all capsular fibers. This rotation of nucleus will free all fibers from capsule. This way capsular bag is very clean at the end of the surgery. Nucleus is rotated, cortical material is taken out to have a more space in the bag to manipulate the nucleus better. Now what I had in my mind is to flip the nucleus. If I flip the nucleus, I will get the posterior plate, that is the hardest part of the nucleus in front, and that way emulsification will become easier. So by giving a support of left hand and using my right hand phaco, I flipped the nucleus in the bag, and you can see it is not a very difficult procedure. Just the thing is your bag should be having enough space to flip this nucleus. So in a very hard cataract it may not be possible, but in a grade 2 to 3 cataracts, yes, it is possible after cortical material removal. Do try this technique. This is very good and has worked very well in my hands in many cases, which recently I have tried. Once the nucleus is flipped, the rest of the procedure is remaining to be same, and phacoemulsification is continued as usual. Saline cornea, rotated nucleus multiple times and grasped it. I am doing a horizontal chop technique, so I have to go to the equator to have a grab of equator so that I can crack the nucleus. I am not doing here the vertical chop where from center we break the nucleus. I am going to the periphery and giving it support and then breaking it. So taking a bit of time to do it. And this was the first case when I flipped the nucleus, so I was slightly reluctant to be aggressive. When each piece of nucleus is taken out to the iris level and taken away with the help of phacoemulsification. Once the nucleus pieces are enough, I am just taking out my left hand instrument so that I can perform phacoemulsification with phaco handpiece itself. This is a torsional phaco, so it will take each piece separately and it takes out each piece very conveniently if you keep your handpiece in the center. Just make sure that you should not have a unstable chamber. Once this is done, I am injecting visco to form the anterior chamber to go for a cortical fiber removals. While taking out subincisional cortical material, I touched the posterior capsule and sucked the posterior capsule into the port of IA. So here I have to just point out that if you hold the posterior capsule, it will not cause any damage. Don't pull it out. If you hold it, just stop there as shown in the video and use the reflex button so that it will go out and your hold is released very easily. So do remember, even though you hold the posterior capsule into the port and stop there, it will not cause PCR. unless and until you pull that posterior capsule towards you, or in a panic you may try to take out your IA probe. So be careful while doing that, and use the reflex feature so that it will release the caught posterior capsule. In case your reflex is not working properly, what you will do is you will pinch the aspiration tube. You can ask your assistant to pinch the aspiration tube so that it will release the posterior capsule. This is another trick which is very important. Sometimes these situations can arise, so just informing. Hope you like this case. Do subscribe to our YouTube channel Dr. Pankaj Lande for more such exciting videos. Good day.